Hey, Hannah, great question about your son with tonsils. First of all, this is not medical advice, so you want to consult someone who works with you directly, and this is just for you to consider. If you haven't watched the video on tonsils, it sounds like maybe you haven't, go watch that because there's a lot of good information about understanding, like, is the child unable to internalize something? Is the child unable to say something? Does the child need more love from you? There's all these different threads in the tonsil video, so go watch that. I have a 3.5-year-old. It just so happens. He'll be 4 in August. If I looked in his throat and I saw in the back of his throat and I saw some large tonsils, I would say, considering tonsils are lymphoid tissue, why would they be swollen? I'm thinking, okay, what chronic stress is the kid under? What things does he feel disempowered to say? What things are challenging for him to internalize, understand? Where could I help him improve his lymph flow? Because if lymph doesn't drain out of here, it swells. Now, the neuroemotional threads are why it's swollen in the tonsils versus in the armpit or in the neck and stuff like that. So you want to take into context the part relating to the body part and why the lymph is there, okay? So I would strongly encourage you to thank your dental hygienist, but say, just because you had your children's tonsils cut out doesn't mean that I'm going to have mine cut out. So thank you, but no thank you. So I applaud you for saying, I'm not interested in that, I'm not willing to do that. I would think about, what is this child doing? Do they have any ear stuff, chronic ear stuff? Are they mucousy, not draining, drippy nose, boogery, stuff like that? You could do castor packs on the liver and gallbladder. You can do castor packs on the lymph ducts, which are right here on the central torso. You could look at rebounding is really good for lymph. But identifying where the stress is going to help him heal the fastest. Because I've seen monster tonsils before. I had chronic ear infections as a child. They cut my tonsils and adenoids out. Tonsils, not adenoids. I think. I don't remember. It's a long time ago. Anyway, the point is for you to say, I'm going to get some more information about what my boy is dealing with and understand him and help him make sense of his life. And then I would also say, where's the stress in the immune system? Where's the stress of the lymphatics not draining and things like that? So that, absolutely. If you have access to PEMF, pulse electromagnetic field therapy, high power PEMF is what's really going to move the needle because it has to be high enough amplitude, high enough energy to actually move the organs on the inside of the body. A beamer mat or something like that is not going to cut it. That's barely stimulating the acupuncture meridian. So go with high power PEMF. We prefer pulse PEMF. Awesome sauce there, best in the business, most versatile. The XL Pro, you can go any which direction. You can do it gentle on the brain. You can do it high impact on the joints. It just depends what you need. So plug for that because I love it. I don't have any financial affiliation with them, but we use it every day. I have 7 different units here. So go for that. Find someone in your area. There's a link in the bio to find a practitioner or a clinic or something like that near you that has that. Or it's on Pulse PMS website. Just find a practitioner, okay? Check back. Let us know how it goes and saving those tonsils. And good luck for you, Mom.